Today, the Senate Insurance Committee heard testimony on Senate Bill 251. Senate Bill 251 is known as the Healthcare Transparency Bill. And in a nutshell, what Senate Bill 251 does is it gives the patients their out-of-pocket amounts that they're going to owe for non-emergency services instantaneously, that is to say in real time. In other words, the computers in the doctor's office will communicate with the computers at the insurance company to give patients their total out-of-pocket expense before they consume non-emergency healthcare services. And to listen to the entire testimony, it's coming up next. This slide is really, it's important because it just demonstrates how things have changed between what insurance companies pay and what the patient pays out of pocket. And I'm going to walk you through this as quickly as I can, and I want you to pay attention to the things that are highlighted in yellow on the screen and they're kind of grayscaled on your sheet of paper. The thing I want to point out right away is when you go to the doctor's office and you get a charge, the charge is meaningless. Nobody pays the charge. It goes back to 1980 when Medicare was trying to convince physicians to accept assignments. So it has no meaning. You never pay it. And what happens is we all have contracts with insurance companies and we give discounts. So the key number in healthcare is what's called the allowable amount. And it's that guy right there, 1338. That number drives the whole entire healthcare system. That 1667 charge is meaningless, but that right there is the number that we're after with this real-time EOB legislation. If we have that number, everything else falls into place. And we can't get that number very easily from the insurance companies. And that's why patients never know what their out-of-pocket is until they get a surprise bill 30 days later. I'm sure everybody that's had any healthcare issues has experienced that. So let's walk down that 1338, let's walk down to this column, and I'll just start with 1338. So right now, with everything going on in healthcare, almost everybody has a $1,000 deductible if you work in the private sector or more. The ACA plans on the exchange, I think the bronze is $4,000 to $6,000, the gold is $300 to $500. So everybody's seeing these large deductibles. So how the math works is you take the allowable, you subtract the deductible because that's all out of pocket all the time. And you get what's called the co-insurance amount, which is at $338. So everybody has co-insurance. Traditionally, it used to be the patient paid $20, the insurance paid $80. Now with the ACA plans, the patient pays 40% and the insurance company pays 60%. So you can just see the dynamics of how healthcare is changing. The expense of healthcare for non-catastrophic procedures is all on the patient's responsibility. And this number becomes important because you sure don't want the patient to be paying that number. That number could be anything. That number could be $50,000 because the discount would just be $49,000. So that's the key number. So you take that allowable, subtract the deductible, and you get the $338. In this example, 20% goes to the patient, 80% goes to the insurance company. So the patient pays $1,000, then 20% is $6,760. So this is what the process looks like. Of course, we have this fictitious charge, we have the insurance negotiated piece, then we come back down to that 1338, which matches that. The patient pays $1,000 deductible, then the patient pays 20% of that number. So here's the patient out of pocket. $1,000 for the deductible, $6,760 for the co-insurance. The patient is responsible for $1,067.60. The insurance company only pays $270.40. This is an actual patient that had cataract surgery at Discover Vision with a commercial plan. This is not made up. This is how it happens. Cataract surgery is the most performed surgical procedure in the world, so it happens a lot. So patient goes home 30 days later, gets a bill for $1,000. That's a house payment. So the accounts receivable aging in the private sector is getting very old, and we're sending lots of people to collections, and we're disturbing the physician-patient relationship just because we don't have cost transparency. Nobody's died from not having cataract surgery. If this patient needed to wait 3 months to save up their $1,000, no harm done. They could wait 90 days, save up their $1,000, problem solved. But you'll hear from the other folks that deal with this on a daily basis. Finding that number out is a manual process. There's no technology. We have technology to determine if patient has insurance. We can ping the insurance database in 3 seconds, and we can tell if patient has insurance. We know we can ping and find out what the deductible is, and we can ping to find out what the copay is. The major number we can't find is that allowable amount. And that real-time EOB will address that in real time and give the patients the information they know that they need to make informed health decisions on non-emergent services.